Good morning again, and welcome to the June 2022 In-Services. And now I'm going to turn it over to Ashton, and she is going to talk about serotonin syndrome. And we can see your screen, Ashton. You are set to roll, okay?
Okay. Hi, everyone. Like Dr. Baldwin said, my name is Ashton, and I'm going to be talking about serotonin syndrome today. The objectives for this presentation is to develop a general understanding of the definition of serotonin syndrome, including its clinical presentation, symptoms, diagnosis, and treatment. Also, to be able to recognize the common medications and other causes of serotonin syndrome, and to identify serotonin syndrome prevention options and what to do if it occurs. So we're going to go over the definition, the symptoms, the symptom severity, clinical presentation, diagnosis, causes, which medications cause it, treatment, prevention, and what to do if you suspect serotonin syndrome. So serotonin syndrome is caused by elevated serotonin levels. So there's too much serotonin in the body. It's usually caused by a medication or a combination of medications, and most cases are caused by 2 or more medications that increase serotonin. The incidence is unknown because it's really hard to diagnose, but it's considered rare, and it's significantly underdiagnosed due to a variable and wide range of symptoms. Serotonin is a chemical produced naturally in the body. It's synthesized from tryptophan, which we get from our diet, and it's inactivated by monoamine oxidase, also, and it's abbreviated as MAO, and that will be important when we talk about medications that can cause serotonin syndrome and how it can happen. The main functions of serotonin are nerve cell and brain function, and it carries messages from the brain to other parts of the body. There are serotonin receptors located all over the brain and body, and it has many functions, but it has a key role in mood, sleep, digestion, and many more. So since there's receptors located all over the body, it causes a wide range of effects. So this is a figure that shows the serotonin pathways that go all over the brain. As you can see right here, they pretty much go everywhere. Almost every brain cell is close to a serotonergic fiber, which is why it has so much wide effects. And almost all behaviors and many brain functions are regulated by serotonin. Some of these that I wanted to point out are muscle control, CNS vascular tone, which means our muscle tone. It also regulates our respiration and our body temperature. And these will come into play when we talk about symptoms of serotonin syndrome. This is just another figure showing where all serotonin acts in the body. And I wanted to point out some other key functions that serotonin has that I didn't mention before. One is regulation of heart rate, and then nausea and emesis. Emesis is vomiting, so it plays a role in when we feel nausea and when we vomit. Also, it plays a role in vasoconstriction and dilation, so it regulates our blood pressure and can play a role in high blood pressure or hypertension. Like I said, it has a wide range of symptoms, and they're divided into 3 categories. mental status, neuromuscular abnormalities, and autonomic dysfunction. Some of the altered mental status changes are anxiety, insomnia, agitation, restlessness, coma, delirium, and confusion. Coma is in a more severe case. Neuromuscular abnormalities, this includes tremor, the inability to remain still, myoclonus, which is involuntary muscle twitching or jerking, and muscle rigidity. Autonomic dysfunction, that includes fever, high blood pressure, high or increased heart rate, fast breathing or difficulty breathing, sweating, dilated pupils, and nausea, vomiting, and diarrhea. This is a slide going over the symptom severity. As I said, some symptoms are more mild, but then the more severe symptoms can lead to life-threatening toxicity. I'm gonna just let you read these symptoms on the left, and they're in the handout also. But I wanted to go over this figure on the right because it has some terms that I wanted to explain. So akathisia is the inability to remain still. Clonus is involuntary muscle contractions. Hypertonicity is muscle tightness, so your muscles kind of lock up and make it harder for you to move. And then hyperthermia is a high body temperature of 104 degrees Fahrenheit or greater. There's a rapid onset of symptoms, and most patients present within 6 hours of starting or increasing serotonergic medications. Mild symptoms might be overlooked or dismissed as something else. This is because something like nausea, vomiting, diarrhea, and fever might be dismissed as a cold or some other type of infection. And then mild cases may present as subacute or chronic symptoms. Subacute means that it's in between chronic and acute. Acute, we consider symptoms last a short period and it has a sudden and quick onset. But chronic symptoms last a lot longer, sometimes for weeks to months. There are a wide range of symptoms, like I've said many times, that vary by the severity of the toxicity, and they vary by the individual patient, which is what makes it so hard to diagnose. Symptoms might not occur all at one time, and patients can progress and deteriorate rapidly. If serotonin syndrome isn't treated, it can lead to seizures, multi-organ failure, coma, and even death. But if medications are stopped early, many cases are self-limiting. And self-limiting means that symptoms are mild, they're not life-threatening. So something like a cold would be considered self-limiting. And it has a mortality rate of somewhere between 2 and 12%. It's hard for them to really be sure just because it's so underdiagnosed. There are no specific tests available to diagnose serotonin syndrome. Blood levels of serotonin are unreliable and don't correlate with clinical findings. The diagnosis is more based on symptoms, physical exam, patient history, including medication, supplements, and illicit substances like illegal drugs, because these can all cause increases in serotonin. And it's more of a diagnosis of exclusion, meaning that all of the other possibilities have been ruled out, and this is the only possibility left. But some clues that can key providers into that it may be serotonin syndrome are every case of an overdose, if a patient's on multiple serotonergic medications, all catatonic patients, and any patient with neuromuscular symptoms like twitching, tremor, and rigidity, because not a lot of conditions cause those. This is more just for your information. It's just a figure kind of showing how important medication history is and symptoms in the diagnosis. This figure is called the Hunter's serotonin toxicity criteria. And it's based on if they've been on a serotonergic medication, and it's based on these unique symptoms. It's important to know how it happens so that we can prevent it. It rarely occurs with just one medication, and it's usually due to drug-drug interactions. So the administration of 2 or more medications and or substances that can increase serotonin. By substances, I mean herbal substances or illicit drugs. Some of those can also increase serotonin. And then overdose, either intentional or unintentional. If you take too much of a medication that increases serotonin, then the serotonin levels are going to increase and build up in your body. This is a list of exactly how it happens in your body. So decreased serotonin breakdown. It stays in the body longer and can build up to toxic amounts. Decreased serotonin reuptake. This is how some of the medications for depression and anxiety work. They decrease the serotonin reuptake into the nerve cell so that it isn't broken down and it stays in the body longer, and so that it can produce more of its effects. Increased serotonin precursors, which means these are the things that help make serotonin. So more serotonin is made and it builds up. Or agonist. Agonist is a substance that produces the same effect as something. So a serotonin agonist would produce the same effects and symptoms as serotonin. And then there can also be increased serotonin release. There's also CYP450 interactions. CYP, this is a type of drug-drug interaction. CYP enzymes, these are enzymes that are made by our liver, and they help our body metabolize drugs so that they can be eliminated from our body. Not every drug is eliminated by this route, but the majority of drugs are. If these enzymes are inhibited, which can be caused by different drugs, then our body can't metabolize and eliminate the drug, causing it to stay in the body. So in this case, if a serotonergic agent stays in the body, it can keep increasing serotonin by one of these mechanisms, and this leads to side effects and toxicity, aka serotonin syndrome. So these are some of the medications that can cause serotonin syndrome. All of these, except for the last row, are drugs that increase serotonin in the body by some mechanism that I just mentioned on the previous slide. Anytime these drugs are taken together, there's a possibility for serotonin syndrome, since there's an increased level of serotonin, and the more serotonin, the more likely serotonin syndrome is to happen. So some of these drugs that increase serotonin are antidepressants, like serotonin selective reuptake inhibitors, or SSRIs. These are drugs like fluoxetine or Prozac, and sertraline, which is also called Zoloft. Serotonin norepinephrine reuptake inhibitors, or SNRIs. These are drugs like duloxetine or Cymbalta and venlafaxine. Tricyclic antidepressants or TCAs. These are amitriptyline or nortriptyline. MAOIs, which means monoamine oxidase inhibitors, phenolzine, and some other antidepressants that increase serotonin are trazodone, buspirone, bupropion, and mirtazapine. Certain opioids can also increase serotonin. Some of them include tramadol, methadone, dextromethorphan, which is an over-the-counter cough suppressant, and fentanyl. Some anti-nausea medications like ondansetron or Zofran and metoclopramide. Anti-migraine medications such as sumatriptan. Anti-seizure medications, valproate and carbamazepine. And one antibiotic can also cause increased serotonin, and it's called linezolid. Others include lithium, amphetamines. So an example of an amphetamine would be Adderall. These are things that are used for ADD or ADHD, and weight loss drugs like phentermine. And then, like I said before, illegal drugs like LSD, ecstasy, and cocaine can also increase serotonin. There are certain supplements and herbal products that can increase serotonin too. These include St. John's wort, which many people use for depression, tryptophan, and ginseng. For the other drugs on the last row, these don't increase serotonin themselves, but they inhibit the enzymes that metabolize some of these other drugs that increase serotonin. These were the drug-drug interactions that I mentioned on the previous slide. So for example, when citalopram, which is also called Celexa, it's an antidepressant and it's in the SSRI class up here. And fluconazole, which is an antifungal, is also called diflucan, and it's used for yeast infections. When they're taken at the same time, fluconazole inhibits the enzyme that metabolizes the Celexa, so the Celexa isn't eliminated from the body, and it accumulates, causing serotonin to build up, and then that leads to the potential for serotonin syndrome. Some of the risk factors include the greater number of serotonergic agents is the greater the risk. The more agents you're on that can increase serotonin, the higher your serotonin levels can get. And also a combination of age and comorbidities. So as we age, we're more likely to develop conditions and diseases and to have multiple conditions and diseases. Multiple comorbidities, so multiple diseases lead to more medications, and more medications increases the risk of polypharmacy and adverse drug reactions. Polypharmacy is the use of multiple medications, and it can lead to the increased risk of drug-drug interactions and drug disease interactions that can then lead to serotonin syndrome. Also, when you're on more medications, it's hard to keep track and to manage your medications. Even in younger people, when they have to take multiple drugs, they can forget, and it's hard to remember what you've taken and if you've taken a drug. So this also increases the risk of drug interactions and adverse drug reactions. Also, as we age, we're more likely to experience side effects that are due to the natural aging process, which is something that happens to all of us as we age. Our kidney and liver function decreases. And this is significant because our body uses our kidneys and our liver to eliminate drugs. So if they don't work as well, they can't eliminate drugs as well. So the drugs stay in the body, and that increases the risk for side effects and toxicity. Also, like I mentioned before, the liver makes the CYP enzymes that also help us metabolize and eliminate drugs. So if the function is decreased, your liver won't make as much of those enzymes. And then if there's not enough enzyme, the drug can't be metabolized and eliminated as well. So again, it stays in the body. Also, as we age, there's a decrease in lean body mass, an increase in total body fat, and a decrease in total body water. This affects how some drugs are distributed in our body, and it can increase concentrations of those drugs, which also increases the risk of side effects and toxicity. Kidney and liver failure are also more likely to happen as we age, but they can happen at any age for a variety of different reasons. So like I explained before, anyone with kidney or liver failure, they're more likely to develop serotonin syndrome since they can't eliminate drugs as well. Anxiety, depression, and pain are common problems in older adults, also just in the general population. So a lot of the drugs used to treat anxiety, depression, and pain were on the list that you just saw on the previous slide, and they all work by increasing serotonin. So if you have one or more of these conditions, you're more likely to be on a drug that could cause serotonin syndrome. So hopefully I explained well, and you guys all understood how as we age and the more diseases and conditions that we have and the more medications that we take, that increases our risk for serotonin syndrome. And it's usually a combination of age and these multiple comorbidities that causes serotonin syndrome. Also, patients can be genetically deficient in the CYP enzymes, and the same thing happens with them as I mentioned earlier in liver failure. They don't make enough of the enzyme, so they can't metabolize and eliminate the drugs as well, which increases side effects and toxicity. It's really not that uncommon for people to be deficient in these CYP enzymes. It's just not routinely tested for. Genetic testing is often really expensive, especially if you don't have a specific medical reason to be tested. These are the most common combinations of medications that cause serotonin syndrome. Historically, it was MAOI and SSRI or another serotonergic agent. And it has been shown that the SSRI and the MAOI combined together pose the greatest risk, but the MAOIs aren't really used much anymore because of this reason. And they also have many other drug-drug interactions and side effects. So that's not really the most common cause anymore just because they're not prescribed. Now, more commonly, it's seen with 3 to 6 serotonergic agents. So for example, an SSRI plus trazodone plus tramadol plus Buspar. And also an overdose of an SSRI. And this is just because SSRIs are the most common medications that are prescribed for anxiety and depression. So we just see more of that as a result. So for treatment, the mainstays of treatment, also considered the gold standard, are to discontinue the serotonergic agents and provide supportive care. So supportive care is IV fluids and correction of vital signs. This would be getting their fever down and controlling blood pressure and heart rate, things like that. Most patients improve within 24 hours, and the intensity of treatment depends on severity. For mild to severe cases, so everyone gets a benzodiazepine. This helps with the symptoms that they experience. A benzodiazepine is something like clonazepam or Klonopin. Moderate to severe, they might get a serotonin antagonist. An example of this is cyproheptadine. An antagonist is something that stops the action or effect of another substance. So a serotonin antagonist would stop the effects of serotonin. And then in severe cases, they're going to get all of the above, plus sedation, paralysis, and intubation. So the best thing that we can do is just to prevent serotonin syndrome. Some ways that we can do that is be honest with your healthcare providers, or encourage your patients to be honest. Always tell your healthcare providers which medications you're taking, even if it's an illegal substance or an herbal supplement. You might think that those things aren't a big deal, but they really are. As you can see, and many people don't realize that when taken with other medications, they can cause life-threatening drug-drug interactions. It's also important to keep track of your medications and know which ones you take. Keep a log, write them down, or even bring in your bottles. This helps to everyone on your healthcare team to make sure that there's no double prescribing, or they don't accidentally prescribe you something that can cause a drug-drug interaction because they didn't know you were taking it. Ask questions, find out if any of the medications you're on can cause serotonin syndrome, so that you can know to be on the lookout for the signs and symptoms. Medication adherence is also important, to make sure that you don't take too much of your medications. This happens a lot unintentionally. Follow your healthcare provider's instructions and take medications as directed. And then use medication adherence techniques like pill boxes, alarms, reminders, or just asking for help so that you don't take too much accidentally. And then also recognize and report side effects of any medication. Remember that non-toxic increases in serotonin can cause anxiety, restlessness, and irritability for 1 to 2 weeks. So it could be non-toxic now, but if another medication that affects serotonin or the metabolism of the medication that's causing the side effects, then it could become toxic at some point. So always tell your healthcare provider if you're experiencing any side effects, and then recognize and remember the early signs and symptoms, and those are all listed on your handout as well. Also, like I said, there is the genetic testing for the CYP genes, and that can be considered. It's probably going to be expensive, but it might be worth it if you're at an increased risk or if you've had serotonin syndrome before. If you suspect serotonin syndrome, don't wait. Take action. It's better to be safe than sorry, and because it can progress quickly and become deadly fast. And it can also cause those other complications like organ failure that are irreversible and will last the rest of your life. Stop taking the medications that could be causing the serotonin syndrome and get to the hospital as soon as you can. Once the symptoms are gone, other drugs can be tried or restarted at low doses slowly. This is going to depend on your provider and what caused the serotonin syndrome to occur in the first place. And then this is an instance where the genetic testing might be recommended. These are my references. And now I will answer any questions.
Very good, Ashton. I'm not sure if I have any questions, so I'm going to pause it to see if anybody else does. Specifically, the one who requested the presentation, I don't know if she does yet.
Okay.
But very good, very thorough.
Thank you.
No, I don't have any questions because it was very thorough.
Thanks.
So thank you, thank you.
Of course.
Excellent. So then, hearing or seeing nobody else unmuting themselves and seeing none in chat, I am going to, and right on cue, I'm going to stop